Hi, everyone, and welcome. I have Dr. Eugene Manley with me today, and I'm really anxious to get into his story to share that with you on the Sharegiving secret. So, Eugene, could you start us off a bit? And welcome to our podcast today. And could you start us off a bit with where you are in life now and how you came to be there and what you're working on?
Thank you, Deborah. It's a pleasure to be on the show. It's always good to hear your stuff, and I'm so glad that I'm on here. I guess for your audience, I am Dr. Eugene Manley Jr., and I'm the founder and CEO of the STEM and Cancer Health Equity Foundation, which works to increase STEM workforce diversity. Sorry, and I will fix that and improve outcomes for under.
We'll just start where from what you were saying again, because that
Yep,
right.
I'm trying to make sure I get this mic out. There it is.
Oh,
There
sure.
we go. Because it's going to keep interfering. There we go.
Oh, I see what you're saying. Okay. Yeah. All right. So pretend I just asked you that question. You can introduce yourself again. Go ahead.
All right. Hello. It's a pleasure to be here on the show with you today. I'm really looking forward to talk to your audience about the work that I do. By, I guess, background, by training, I'm a mechanical engineer, a biomedical engineer, and a cell and molecular biologist that has specialized in musculoskeletal biology, biomechanics, and cancer biology. But I grew up in inner city Detroit as a first gen scholar, and I saw how healthcare was and wasn't delivered to my family. And then as I navigated academia, I saw a lot of mentorship programs for diverse scholars, but they didn't really understand some of the lived experience of first gen students, and they weren't necessarily conducive to making sure these students could propel and excel in these biology careers. And then as I transitioned over to the nonprofit space, I saw a lot of barriers in delivery of materials to diverse and underserved populations. And people started asking me to speak about lung cancer disparities. And ironically, since my PhD was in lung cancer, this made sense. So I ended up eventually launching the STEM and Cancer Health Equity, which I launched in August of 2023. And the goals of the nonprofit are to work to increase STEM workforce diversity and then get information and resources to underserved populations to help them better understand and navigate medical care and advocate for what they're entitled to.
That's great. Wow. That's a lot of lifetime lived already, and there's more to talk about. So I appreciate your sharing all that experience with us. Now, I know that your caregiving story began when you were very young. Could you take us back to that moment and help us understand what it's like to become a caregiver before you're really allowed to be a child?
That was very interesting. As a kid, I grew up in Detroit, but my grandparents were in West Virginia, and we used to go down to West Virginia every summer, probably until I was 9 or 10, to help the grandparents. But then my mom moved them up probably after I was 10. And what was interesting is, I finally had my own room at that point, but then when they got moved up, I had to no longer have a room and I slept on a floor. And that was just because there's no space. And and you're just upset, not at the grandparents, but you're like, I have a room and now I don't have one. And then I'm have to be a caregiver and be up in the evenings and then trying to help alleviate the pressure on my mom, but at the same time still trying to study and do schoolwork. And so you are forced to grow up and, for lack of a better term, do adult things, for lack of a better, being a caregiver, having that responsibility and you didn't ask for it, but the help is needed. So it's you learn empathy, but it can be stressful, it can be exhausting. And I did it as a kid, but you look at the flip side of it and having to do it as an adult caregiver, it's even more challenging because at least as a kid, you know you have a path forward, but as an adult, you might still have to do that and you don't know for how long.
Yeah, the indeterminate nature of it. We don't know when it's going to end and so on. And most kids understand a bit about deferred gratification. They have to wait for something, but that's a lot to wait for. To be have to be an adult in much of your waking hours, and when you wake up again, it's still
Yes.
a situation. So it's not like one day, okay, I can do it, but a childhood lifetime, in fact. Um, how did caregiving at such a young age shape the adult that you became, especially your empathy, your limits, and the way that you see responsibility now?
It's kind of interesting. In one hand, when you're a caregiver, you learn to be more patient, caring, understanding, because if the person you're caring for probably likely is not in a position to completely care for themselves, and they are probably helpless, sometimes hopeless, and they're frustrated. And so you're trying to provide some comfort that you can. So you have to think of it in that lens. And so if you think of it that way, when you go out in the world, you tend to have a different lens on when you see other people that might be struggling to walk or having mobility issues. It's just ingrained that, well, why would I laugh at that person? You shouldn't, if you can help, help, because you just don't know what people are going through. And you also don't know what they're going through based on their appearance. Because, sometimes people will get upset. Well, why are they using this handicap sticker and slot? It's like, but you don't know what they are actually facing, and it's not their job to tell you.
True. It's an interesting aspect of caregiver caree relationship that doesn't come up in other types of friendships or even family relationships. Do you think that this has influenced the type of work that you do as an adult in some way? Did you choose because of or in spite of that kind of background?
I think the later stuff probably was inspired by that, because when I was a kid, I was like an Energizer bunny, and but I was a chronic asthmatic, and I was in the hospital 20 to 30 times a year just for my asthma, probably from when I was 5 until I was 10. So it is a miracle I even got to this point, because like we didn't really have epinephrine readily and EpiPens, and so I got used to being in hospitals and doctors, and my father was a chronic smoker, and I think that exposure probably made me a little probably helped put me in a state where I have more asthma. But when I was going through my college, I didn't think much about caregiving, but my family was still calling as I was finishing a PhD and postdocs, and would ask questions because they don't understand the my chart, and so I'm trying to translate and give advice from afar. But you only can do so much when you're not in the situation. So you have to try to temper everything you say to try to be as accurate and helpful as you can. But then, when I started in patient advocacy, you see a lot of the similar issues with patients not having information and resources, not knowing who to go to, not knowing where help is. And so probably at some underlying level, that level of empathy came back in. Not that I ever lost it, but you understand how you can help people who don't understand how to navigate spaces.
Yeah, sometimes too much information is not helpful. And even though there's plenty of it available now, it doesn't always help people make decisions when they're overwhelmed already. So that's a good point to raise. Now, we've talked a bit about what it was like for you to care for others and that the empathy comes along with it. But I know that you've also experienced what happens when you needed care and didn't have a caregiver. What did that reveal to you about our healthcare system?
Ooh, that is quite a challenge, and I'm a PhD molecular biologist, and I have a background in biomechanics, so I'm pretty on top of medical stuff. And me and the surgeon had a comprehensive treatment plan, and so I was prepared for the pain. I was not prepared for the hospital staff to misrepresent and fabricate things in my medical records to say I had no pain and could ambulate after my reconstructive surgery of my foot. I was not prepared for them to try to give me early discharge notices. I was not prepared for them to ask me about my ability to pay for skilled nursing, but that's not even remotely in the job description. And because there was a concerted effort to try to push me out and then misrepresented my records, this impacted my ability to get skilled nursing. And actually, it caused me to not get skilled nursing because the surgeon tried to do a peer to peer. And it took 5 days for him to even get PT to answer him because they didn't want to answer him. And he had to complain. And then insurance was, well, why did it take so long? He said, well, I was trying to get PT and they wouldn't answer. But in that time, he lost his appeal because PT said I had no pain and could ambulate, which was not remotely possible when you have triple bone fusion and it's a surgery that's your non-weight bearing for at least 6 to 8 weeks. So that really, really opened my eyes because I think about a lot of stuff my mother went through before she died when she was in different hospitalizations, and they would just be so mean to her at night, or just say just snide things when no one was there. And then there's me who should have had no issues. And like I said, the surgeon was not the issue. It was the rest of the staff. But, he didn't have direct admitting privileges. So he couldn't really drive the post surgery care. But it revealed that even though you can know healthcare and know how to advocate, you still need a medical proxy with you in real time that can read your records when you have a surgery. And the reason you want that is if you can answer the day, time, and where you are, even no matter how much you are on opioids or drugs, they will say you're AO times three. So you're alert and oriented. And by that token, you are able to answer questions. This is what they use on me to say, well, he said this. And I was like, I don't remember answering any of those first 3 days. Now, my medical proxy was in Florida. And I had her listed because I knew my brain, I have ADHD, my brain is always firing. And I knew I would not be able to accurately reply. But because they apparently said AO3, they never contacted her. So this made my stay in the hospital a lot more harrowing than it needed to be. So it taught me that you really need someone there in real time that can read and advocate. And now I learned you need someone that reading your records, and I just never thought that would be something that I would have to go through.
Yeah, it's astounding to me the level of bureaucracy, and I think it's global. I was hospitalized in Hong Kong not too long ago, and while everyone was very nice to me, there was a miscommunication about medication right after the surgery, so I didn't get any until almost 24 hours later. And that was a really eye-opening experience to me that no one called, no one followed up on anything. And they had a nurse sit with me while I cried, but they didn't think to call anyone. I kept saying, could you call someone? Is there someone? And it's interesting that it's not just in our country that this is happening. And I can't say it's all over the world. I said global before, but I have a feeling that there's so much bureaucracy and so many stops to actually delivering treatment that we do have a big crisis all around the world. So I am sorry that happened to you. And I hope that, that's something we could do something about in the future. Now, you mentioned healthcare proxy, and I know that many caregivers don't see themselves as advocates, though, because they're just trying to survive. Some caregivers, and you may have felt this even as a child, are just overwhelmed. Based on your experience, what does advocacy really mean? And what's one place that caregivers could start if they are feeling overwhelmed?
It's caregiving is one of those thankless roles and positions, and no one necessarily is jumps to do it, and you're not elected to do it. It's just you kind of do it either out of the kindness of your heart or because no one else is there. And that can in family dynamics present as frustration, um grief and battling between siblings, people believing one cared more than the other because they were there. But if everyone is trying to live their life, and it's not easy, and it's never an easy conversation to say, well, one should be here and you must come back, but because if you come back to be a full-time caregiver, that means you've given up your job and your career. And depending on what you do, you may not be able to get back in the workforce, which is unfortunately what happens to many Black women who are caregivers. They never get back in the workforce, so then they never get to save any money. And then they get wore down, and then they're in the same position of being a caregiver when they get older. So, advocacy is really knowing your resources. If you're low income, what you can use. And the tricky thing is learning, there's some income limits for stuff, which makes it more frustrating. That's the most frustrating. Well, if we do this, it'll put us over this cap, and then we'll lose this service. So then you're having to continuously rationalize, okay, I want it, but is it worth me getting if I lose A, B, C, D, and that is something I wish we could streamline and get to change. And I also think the caregivers, I know it's hard when you're the caregiver, but if you could just try to get someone to give you a day off or something, you can just go relax, or just have time to yourself, which is really hard when you're a full-time caregiver. But um, nothing really helps if you also burn out and crash, and under all the stress, and then you're taking uh often the abuse from the care person you're caring for, and not because they're necessarily bad, but they're frustrated, and then they often lash out at you, the caregiver, and then how are you supposed to respond?
Yeah, the overwhelm is a really good place to start tackling it. And I think sometimes families really don't understand the kind of servitude that they're putting one relative through. I don't know how else to describe it. And it's not just emotional and health, which are terrible things to sacrifice, but also financial. If you're out of the workforce, you're not contributing to your future for Social Security or any kind of savings. So you're going to lose in every which way possible as a human being and as a citizen if you are a full-time family caregiver. And we really need to do something about that. So I'm so glad that you brought those things up, but I am not glad that they still exist.
Yes, yes.
Yeah, and we have to keep bringing that message forward because I think governments are short on understanding for that because it is very costly to make sure that burnout and other diseases don't come as a consequence of caregiving. To provide that relief is going to cost the country and everyone quite a bit of money because it's hard to replace a person. But here we are making two sick people where we only had one before in each case. So I don't
and
see.
and this ties into indirectly or even directly income, race. It's more, when you are from an affluent family, you can afford to pay for nannies and other caregivers, that those who are not well resourced just don't have those options. And then for them, insurance is not really a barrier because they're independently wealthy. So that takes that, so you can pay for it. And when you don't have those two buffers, you're at the whim of the system and whatever insurance plan you are on.
Yeah, and if we have to try to forecast, I remember long-term care insurance was a big item earlier in my marriage, a big question, and trying to think about financing something that might happen 50 or 60 years down the road, it's impossible. If I had thought about how much money, I never would have come up with the numbers that we are seeing now. So even if you're relatively well off, the future is more expensive than most of us imagined at that time. So it's a staggering problem, and we really need to do something about it. And we need some innovation in terms of how elders are cared for and how special needs children are cared for, so that we can make sure that all adults have a quality of life that we promise ourselves, life, liberty, and the pursuit of happiness. We keep forgetting about the happiness part, I
And,
think.
and you brought up a very good point. the country is not getting any younger, and we were actually getting an increasingly aging population here, but not just here, but abroad. You're seeing like Japan and everyone's aging, but there's not enough people to replace them in the workforce. And even we see here that we don't have enough doctors coming out to even treat patients. But on the flip side, many doctors are getting frustrated and leaving because they don't want to deal with insurance, or they're getting brought out by conglomerates, which then, of course, restrict all the services and then run the companies and the business. Then the communities lose the one primary care they had, and so it's a vicious cycle.
Yeah, yeah, and we better intercept it soon, or we're not going to be able to get it back. Now, I know that you've turned lived caregiving and loss into health equity work. For any caregivers listening who feel exhausted or invisible, what do you want them to know right now?
I want them to know that, no, I know it's going to sound cliche, but you're not alone. Um, there's a lot of people that are going through it and also doing it silently, which is the challenge, So, and that when you do this alone, because your life is dedicated to caregiving, you end up losing or changing a lot of your relationships with people that you have because you still have caregiving on the back of your mind. So you have to try to find people that understand what you're going through, or that you can find some kind of community, or at least now we can do a lot of stuff virtual. So if you can have a virtual meetup group, just, hey, 30 minutes to see how people are doing, what are you doing navigating this disease, I was recommended this treatment for my the person I'm caregiving for, do you know if this works without any side effects? So you can sort of intercept the stuff that you may not be able to directly get from the doctor.
Yeah. So information and sharing it is really key to our survival as caregivers. And I think that leads us a bit into your project. So could you talk a bit about your personal project now, what you are working on?
So I run, the nonprofit called the STEM and Cancer Health Equity, or SHEC Foundation. And like I said, it really focuses on increasing STEM workforce diversity, and getting information and resources to underserved patients to help them better navigate medical care and cancer care. And you think of it broadly, it's kind of three pillars. One is really trying to get diverse kids exposed to STEM at early ages and helping them understand that they can go to college, and what kind of career paths they have. The second part is really in that workforce development and diversity, because this is where a lot of our providers either fall in or fall out of the system. And so if we don't have a workforce that reflects the populations with the highest incidence of disease, or reflect the communities where these patients are treated, then we're going to continue to exacerbate and keep funneling in bias into these systems, and then the patients don't feel seen and heard. So we try to work to develop mentorship and training programs to help these scholars navigate, undergrad, grad school, postdoc, and like which degree or paths did you take, and making sure they know what's available beyond what just academia teaches them. So hopefully we can get them in the workforce. So then we work on our last piece, which is the health equity and health literacy. So we do infographics to break down basic medical information as well as cancer information. And we do our annual lung cancer health equity or intervention summit, where we bring together patients, caregivers, and survivors to learn more about the disease, learn more about how they can advocate, and learn who is working on their behalf, either locally or nationally, so they can refer people. And then we have researchers, clinicians, payers, etc., come talk about the interventions that they're creating that are removing these barriers and disparities. And by having everyone in the same group room, you break down these silos that often exist between patients, researchers, clinicians, and then you start building synergy so everyone can feel seen and heard.
That's a wonderful, comprehensive project that you have going. Is there a way that our listeners can help you, a way they can reach out if they have something to offer?
Yes, you can reach out, info at sheq.org, SCHEQ. Our social handles for Facebook, Instagram, and LinkedIn are STEM, STEMMCHEQ. And my LinkedIn is Eugene Manley Jr., PhD, so they can follow and connect there. And I'm working on creating probably a school course to help patients navigate care, but I'm kind of working on designing that. So that should hopefully at least have the initial phase up in the next 2 to 3 weeks.
That's fantastic. And we'll certainly put all this information in the show notes so people can see exactly how things are spelled and make sure to reach out to you. So we've come pretty close to the end of our program, but I want to give you the last word. What would you like people to carry away from today, from this interview or from the work that you do? What should caregivers know?
I just want people to know that often we fight things in silence, but know you are still valued and appreciated, and that you are kind of the engine behind what keeps other people going. So just uh, for as exhausted as you are, use that as your superpower. But just know that there are other people that appreciate all the work that you do, and that you should not feel. I know it's exhausting, but don't feel so like you failed. It's not failure or sadness. It's just where you are in life, but just keep pushing forward, and hopefully you can get resources that can help you alleviate the stress.
Dr. Eugene Manley, thank you so much for being my guest today. Your generosity is epic, and I so appreciate what you are doing to help to move human individuals forward. So thanks
Thank
again
you
for
so
being.
much.
You're welcome. My pleasure.